a really important topic to me. This is female hormone replacement. So basically, when you think about medicine in general, if somebody loses a hormone called insulin, they have something called diabetes, and they give the insulin back. When somebody loses their thyroid gland and they lose their thyroid hormone, medicine, conventional medicine will give thyroid hormone back. But for women, when women lose their hormones, estrogen, progesterone, their doctor says, well, here you go. This is how you're going to live. This is how you're going to be living this way, and this is the way it's going to be. Here's a script for some antidepressants. In fact, there was a show on Oprah, and I don't watch Oprah often, but I do catch some of the things. And she had Dr. Phil's wife on it. She relayed this story when she started on bioidentical hormones, which we're going to talk about, that she actually had that same experience where she went to her doctor. Her doctor said, well, you've gone through menopause. Here's 2 scripts for antidepressants and anti-anxiety meds. You're going to need it. So, but the reality is that hormones in women are very important for many things. And just when you lose them, things change dramatically. It's really important to understand that women, the estrogen has 400 functions in the female body. So we're not going to go through each one of those 400, but I'm going to point out some of the very important things that you need to know. When you lose your estrogen, you lose the ability to make a chemical that produces memory and effectiveness in your brain, the neurotransmitter, because estrogen produces this neurotransmitter. Okay? So one thing that we find is when we put women on natural hormone replacement, the first thing that they say to me is, I feel sharper, my memory's better, and all of a sudden I'm less foggy. The other thing is that estrogen also is effective on producing serotonin. When you have low serotonin, it actually causes depression. As far as your heart, important thing, right? Estrogen actually, if you lose your estrogen, your blood pressure goes up. And one of the things I find with a lot of my patients is they tell me, I eat right, I exercise, I've had great cholesterol in my life. All of a sudden, they're having these changes. They do their blood work again, and all of a sudden their cholesterol's out of whack. And the reason is because estrogen has a large part of changing the way that your lipid or your cholesterol panels change, as well as it also decreases your blood pressure. And there's been multiple recent studies that show that women who lose their estrogen early have a much higher risk of heart disease. Bone strength as well, osteoporosis, which is well documented, which you've heard before. But also, the other thing that's really important is skin as well, because estrogen actually produces collagen, and when you lose your estrogen, you actually have a difficulty producing collagen, and thus will produce wrinkles. So when we go through a lot of the things I'm going to talk about today, I'm going to talk about some of the most current cutting edge data that shows about how important female hormones are and why it's important that people should be looking at this a little bit more closely and actually taking care of it. So estrogen deficiency, so you run through the litany of types of things that it causes, but some of the things I'll talk about are low energy depression, increased blood pressure, abnormal cholesterol. It's also going to cause wrinkles and changes in skin. So all these things, when you lose your estrogen, are effectively causing these types of problems. The other thing is facial hair. When you lose your estrogen, you actually become more androgen or male hormone dominant. So that means that you can develop facial hair as well as you develop belly fat, which is also, unless you fix your estrogen, a lot of times this actually is difficult to get rid of. So women tell me all the time, all of a sudden they have this belly fat that they have trouble getting rid of, and the reason is that when you have this hormonal shift, you're not going to be able to get rid of it until you kind of reverse your hormones by fixing it. The other thing is progesterone. Progesterone is another really important hormone, and it actually is overlooked tremendously, because progesterone has to do with your mood, producing anxiety, depression, as well as insomnia. Now, one of the things that we found in our office that women as early as 30 years old start losing their progesterone. And the kind of thing that you sometimes you'll see is when you actually have, your second part of your cycle right before your period. A lot of times women have, mood issues. They start to become a little unbalanced, and that's because your progesterone drops. Now, if you have ultimately low progesterone, it could actually develop into depression. And unfortunately, a lot of women, and one of the last women I had, came in and she's been put on multiple antidepressants. She's in her mid-30s, and we found that her progesterone was low through the cycle. So what we did is we replaced her progesterone, and ultimately we got her out of the cycle, because when you take a lot of antidepressants, they actually lower progesterone. So you're giving something that's actually causing more of the problem. By giving the antidepressants, you're actually making the problem worse. So unless you fix the problem and find out where the problem is, you're not going to be able to do it. So in our office, what we do is we do a much more elaborate group of blood tests that you won't get done in conventional medicine. We look specifically at trying to find out what it is for the cause of all the symptoms, and we try, and we do often, fix the problem, and then all the symptoms start disappearing. So we're going to talk a little bit more about that. And so, as I said earlier, when I'm going to go through a group of different studies that I'll talk about with hormone replacement, it affects your brain, and you can see memory and Alzheimer's disease are all, related. Heart health as well, and bone health. So the main thing that you have to understand about hormones is that there are different types of hormones. And unless you understand this, a lot of times, even practitioners, even your own primary doctor, a lot of times we were not taught this in medical school. So you have to understand that a lot of maybe the bad things that you've heard about hormones in the past have to do with what we call the synthetic oral hormones, Premarin, Prempro, and Provera. Now, Premarin is made of horse urine. It's the estrogen from horse urine, and so the pill, the oral contraceptive that often is given to women, when they're young, when they're old, is made from horse urine. So it's not anything. It's foreign to the body. It's not anything like your structure of your hormones. Provera is a synthetic hormone, meaning that it is not something that is natural to the body. It's something that your body doesn't recognize. It recognizes as foreign. So the way that it responds to your receptors on how your hormones work is very foreign to it. So it doesn't work properly. The other type of hormones are bioidentical hormones. These hormones are the exact same structure as your body. They have the exact same chemical structure, so they function exactly the same as what you take in. So usually these hormones are creams. We devise the exact chemical structure, the exact amount that you need. When you take an oral contraceptive, the pill, you're taking the same dose regardless of how much you need or how little you need. So you never really get the correct balance. Where you take the bioidentical hormones, what we're doing is we find the exact dose that you need and fix it properly. So I'm just going to go through a couple of studies that talk about estrogen, important studies. A study that was done in Utah with 1,800 women who had gotten natural hormone replacement, and they found that the risk of Alzheimer's disease, which is dementia, decreased by 40%. So like I said, the first thing that you'll feel when you start going on the hormones, if you need them, is that your memory will become sharper. You'll definitely be sharper in the way that you react, and you'll have this less fogginess. The other study, there's a bunch of different studies that show that estrogen, when it's low, when you have low estrogen, you increase the risk of developing heart plaques, and you increase the risk of having heart disease. So these were multiple studies that have been done over the last few years that have shown women who have been put on the bioidentical natural hormones have a decreased risk of heart disease. Okay. Another thing about estrogen that we find, again, estrogen has a lot to do with the production of collagen. And when you have low estrogen, you can't produce the protein collagen, which produces wrinkles. Okay, it also produces loss of hair because, again, once you kind of balance towards away from estrogen, you become more, male dominant. So women who have trouble with thinning hair, thinning nails, brittle nails, all have something to do with loss of estrogen. And so, again, when we have women who come in and they replace their estrogen and they're feeling better and the wrinkles start to go away, the facial sciences to get rid of a lot of the dead cells, it helps nurture the collagen. So when you regenerate the collagen, you actually are losing your wrinkles as well. So again, correlating the two types of therapies is really important. So again, we're going to talk a little bit more closely about hormone safety, because this is a really important topic. It's the number one thing that people ask me all the time, because a lot of times you hear things on the news, maybe things from your doctor, and so I'm going to try to, as best as I can, make it clear about the difference in the hormones and why the bioidenticals we know are safe and the oral hormones, the synthetic hormones, are very bad. And people taking the oral hormones need to know this, and I don't know that they do. So when you look again at the oral hormones versus the bioidenticals, you're looking at things between apples and oranges. They're both fruit, but they're exactly different. So the study that was done in 2002, it was a study done on oral hormones. It was talking about Premarin, Provera, and these studies looked at women who were taking this. And what they found is that they increased their risk of having strokes, heart disease, colon cancer, okay, and heart disease. So these were women who were specifically taking the oral hormones, estrogen, Premarin, Provera, Prempro, and this is what the studies found. Because, like I said, the synthetic hormones are unlike your hormones, and they actually function foreign to your body. So when you look at the difference between estrogen, the oral synthetic hormones versus the bioidentical hormones, you look at developing blood clots. Oral synthetic hormones cause blood clots, where bioidenticals, there was no studies that showed that. Oral synthetic hormones increase your blood pressure. We know that bioidentical hormones lower your blood pressure. Oral synthetic hormones cause gallstones. Bioidentical hormones do not. Oral synthetic hormones increase weight gain, diabetes. Bioidenticals actually increase lean body mass, and allow you to lose weight. And as well as the cholesterol, which I talked about a few times, oral synthetic hormones actually increase cholesterol and cause the heart disease. So there was a study done in 2009 in France, because a lot of the bioidentical hormones were being used in Europe, and they found that 80,000 women who were on bioidentical hormones were studied, and they found that there was no increased risk of them developing breast cancer, and they had a lower risk of heart disease, diabetes, and blood pressure problems in all of these types of menus. So they did this massive study, which was 80,000 women, and they found these results. When you look at the synthetic hormones versus the bioidentical hormones, you could see that the results are very different. The other thing that's really important is to understand is that estrogen itself, there's three forms of estrogen in your body. There's E1 estrogen, which is bad estrogen, let's just call it that, because it actually is the highest link to breast cancer. So people who have increased belly fat, and as they get older into menopause, they have a higher level of E1, and this is what is the link to developing breast cancer. E2 estrogen, that's the 400 functions. That's where most of the hormone does its work. And E3 estrogen has been found to do two things. It actually decreases the risk of breast cancer, which they found. But secondly, they're doing studies, which I'll talk a little bit about, where women who have MS have been put on E3 estrogen, and they found that they're decreasing their number of recurrences of MS exacerbations. Plus, they actually decrease the plaques. They're seeing them on the MRI. So amazing things that they're doing. That's actually out in UCLA, which we talk about on our Facebook and our website a lot. So basically, when you take oral synthetic estrogen, you're taking